So we have our friends from Trios in studio with us this morning. And this morning we have a doctor with internal medicine, Dr. Kiran, and we're going to be talking about something that, I think there's a lot of questions that surround it. And right off the bat, we're talking about men's health. And I think a lot of people want to know maybe what you think, why do men seem to avoid going to the doctor so much? And this is not a question coming strictly from me. This is a general question of, why do they avoid it?
Actually, they made statistics on causes of men trying to avoid or avoiding basic checks, health checks here. And majority of people will feel healthy and they say, if I'm not sick, I'm not gonna go and check with the physician here. The principle of preventative health is not really clear, and many medical problems are silent in the beginning. They don't show up. So if I'm not sick, I don't need to go to see my physician. That majority of people will think like that.
And that's not always the case, because really, how often should they be seeing their physician?
After age 40, it's recommended that a visit every 1 to 2 years. Some people who have medical problems like diabetes, hypertension, heart disease, high cholesterol, every 3 to 6 months.
And so there are some routine screening tests and routine things that men should be coming in to get done. And what are some of those recommended screening tests?
Yearly complete physical examination, checking the blood pressure, requesting labs, blood testing for cholesterol, screening for diabetes, and in certain cases doing EKGs. Men above age 50 needs a colonoscopy, and prostate examination, and screening age 40 and above.
All right, so there are a number of things that men should be going in to see their physician about on a regular basis. Just because you don't feel bad doesn't mean you shouldn't go.
Definitely.
We'll have much more with the doctor coming up. We'll be talking about why diet and exercise, it's important in general, but we're going to be talking about why it's so important for men as well. So we'll be talking with the doctor more about that. We'll be back after the break. We're back in studio with Dr. Kiran from Trios, and we probably wouldn't say a job well done to some men when it comes to their health care. They seem to avoid the doctor a little bit. Is that correct?
That's correct, yeah.
But, so we talked a little bit before in our last segment about, why they seem to avoid it and why they need to be seen often. But let's talk about, for men specifically, why diet and exercise is so important.
After age 40, it's normal basically to gain weight. And with gaining weight, risk for developing diabetes, heart disease, high cholesterol, and hypertension increase. You can reverse all of that by assuming a healthy lifestyle with diet and exercise.
And so there seems to be a number of times where, like we said, men do seem to avoid going to the doctor. But when are some of those times that men should definitely not delay when it comes to seeking care?
Red flags that should prompt you to seek medical help immediately is signs and symptoms of stroke. If you have sudden weakness, loss of vision, numbness in any part of your body here, and if you develop chest pain, those are red flags. You should seek medical care immediately.
Always such great information from the doctors that come on with us on Mondays from Trios. We appreciate you being with us. I think the moral of the story here that you could reiterate is
come and see your physician.
Come see your physician, exactly. Go see your doctor regularly, whether you're a man, woman, child. It's important to do that on a regular basis. Thank you so much for being with us this morning.
Thank you very much.
We'll be back right after the break, but first here's a look at what's coming up on Good Morning America.